guys to our newest member of the team.
Hi everyone.
Dr. Paul Sinclair. Can you tell us a little bit about yourself?
So I'm obviously a pediatrician and have a special interest in little babies, always have, and feeding them. I like babies to be comfortable. I don't believe in colic. I think it's an important thing to say, that babies cry because there's a reason for crying, and colic is just a crying baby. And yeah, I have 3 of my own kids who are grown up, and none of them were colicky. One of them is in first year medicine, so hopefully there will be someone to take over my practice one day. And yeah, that's a little bit about me. I studied at UCT and have been in Cape Town ever since, and love Cape Town, and still work once a week at the Children's Hospital at Red Cross, where they train me. So I go and do 2 hours of voluntary teaching there.
Oh, lovely.
So I teach some of the younger doctors and the nurses.
Okay.
So we try and get back a little bit.
Okay.
Yeah.
I want to circle back to that colic comment, because most people label their kids as just having colic.
Colicky. Yeah, I think a long time ago colic was seen as a diagnosis, and that's why, like horses, there were colic remedies. Colic is just a description of a crying child who cries excessively. Babies cry. Babies cry because they're hungry, or they're a dirty nappy, or they're tired. But colic is usually related to a child being uncomfortable for some reason, and it's finding that reason.
Yeah.
Is it acid? Is it heartburn? I think the term reflux is overused. And is it a child that has a milk allergy or some other form of indigestion? You've got to get to the bottom of what's causing the pain and treat the problem, not treat the pain.
Yeah.
We say it's like someone saying, well, look, I've got a headache, but if I take 2 Gen pain a day, I'm fine. That's great. It takes the pain away, but you're not dealing with the cause of the
why
headache.
do you have a headache? Yeah, I agree. Okay. Tell us a little bit about some of the information you included in the guide.
I think I was trying to assist in terms of giving a little bit more specifics, I suppose, to some degree in some respects.
So like the importance of vaccines and...
Yeah, look, I'm pro-vaccination, but I also understand people's concerns, and I always hope that you can, or you should, from your doctor or healthcare professional, learn why the vaccines are important. And why they're probably not as important today as they were 40 years ago when we were seeing measles, or 100 years ago when polio was a much bigger pandemic than coronavirus.
Yeah.
But we still need to keep vaccinating our children, and that it is important and safe, really safe.
Yeah.
And in fact, a whole lot safer today than it was 40 years ago, because the vaccines are cleaner and purer and more effective.
Yeah, and we've got research to support.
We've got decades of research. Yeah, absolutely. Yeah.
And then is there anything else you want to share about the guide?
Well, I think the guide is a lovely reference for new moms, and I think it's been collated obviously by yourself, and it's a good group of individuals in terms of their backgrounds, OTs and speech therapy, and probably far more important than doctors, let's be honest. We're there for some big things, but I think it's a really useful guide. It's nice, it's easy reading, and it's useful information for not just new moms, but moms who need a refresher, because things do change. And one thing we're learning even in this pandemic is week to week medicine changes, and so do things with babies. And old adages like, you can't give your child egg until he's had his measles vaccine at 6 months. It was absolute nonsense, but it was dogma for decades. So and the nice thing is it's a nice guide that I'm sure you can update. And we as a group can keep updating to make it relevant.
Definitely.